Now, more local news from Contact 13.
Yes, we're just about to get started.
Perfect. You're looking right that way.
Overall, if you're a qualified, safe candidate, LASIK vision correction surgery is extremely safe.
And extremely popular as well. Last year, 1 million patients underwent LASIK surgery here in the U.S. This year, experts predict that number could double. During this 15-minute-long procedure, a surgeon uses a razor-like instrument to cut and gently lift a flap of the cornea, then reshapes the exposed area using a laser to correct nearsightedness, farsightedness, and astigmatism. And for many patients who undergo this quick and relatively painless procedure, the results can be miraculous.
But as LASIK fever escalates, specialists warn they're seeing a growing number of patients with serious complications. Many of those patients may have been high-risk candidates who should not have had the surgery. In other cases, what could have been mild complications became serious problems when they went undetected and untreated after the surgery. It's your vision at stake here, so before you decide to have LASIK surgery, Contact 13's Allison McCarthy warns you better take off your rose-colored glasses.
Excellent candidate.
Congratulations, you're a candidate for the surgery.
Very good candidate.
Words that every patient seeking the LASIK miracle wants to hear.
It's safe, it's effective, it's just it's a miracle. Unfortunately, it's such an appealing dream, you know, for someone who's had glasses all their lives. But I think now the glasses are the miracle.
For Gary Lapen, LASIK surgery was no miracle. It was a 3-year nightmare that cost him his vision, and along with it, his ability to drive, work, and live a normal life.
It was a disaster.
A disaster that began when something went wrong during his LASIK surgeries that left one eye with double vision and the other blinded by bursts of colors.
What went through your mind?
Panic. Just sheer panic. You freak out.
And like many Las Vegas patients with LASIK complications, Gary Lapen was eventually referred to here, the Welsh Vision Institute. Dr. Kent Welsh is one of only a couple university fellowship-trained corneal specialists here in the Valley.
He said my only cure was 2 corneal transplants. And both corneas were ruined.
Dr. Welsh says he sees more LASIK complications now than ever before.
A year ago, I was seeing maybe 1 patient a month with a complication, and ranging from mild to severe. Now that these other models have really been in place, we're seeing closer to 3 to 5 patients a week.
Patients like Sally Dobler, who now suspects that because of a number of high-risk factors that she was never warned about, she may not have been the great candidate she was led to believe she was.
And you assume they're the experts.
Sally's LASIK complications include light bursts called halos while driving at night.
I was essentially, going around with really impaired vision. I had 2 car accidents.
The people that are truly harmed are ones that, even with glasses or contact lenses, cannot function, and at some point in the future, many of these people will need a cornea transplant. A cornea transplant is a very major operation.
Gary has already had a corneal transplant to restore the vision in his right eye. His LASIK complications have cost him a year of work and triggered a serious bout of depression. Sally still struggles to see even after additional corrective surgeries to try and offset her complications.
I will never have perfect vision again until they find the ability to perfect the technique.
Gary says his hindsight will be the only 20/20 vision he'll ever have. And if he had it to do all over again,
I wouldn't risk it. Your eyes are too valuable to risk to try to get rid of an inconvenience.
The disaster stories, even though they're few and far between, can in some ways taint the reputation of what should be a wonderful procedure. But overall, it's a tremendous procedure as long as people are careful and do their homework.
And for this story, Contact 13 interviewed several local patients who had serious complications with their LASIK. Patients who had their surgeries at both the discount LASIK centers and some well-established private practices here in town. So if LASIK is extremely safe, why are we seeing these serious side effects? Could it be people who are bad candidates are being approved for surgery they shouldn't have? Contact 13 went undercover to find out. Coming up on News 13 at 6, see what happened when we sent several high-risk patients in for those free consultations here in the Valley. That's coming up tonight at 6, because as safe as LASIK may be for most of the people undergoing the procedure, it is definitely not for everyone.
Like the man said, do your homework.
Absolutely. We'll show you how to do that later, too.
See you back here at 6.
Now, more local news from Contact 13.
Treatment complete.
LASIK fever is sweeping the country and Las Vegas, but as popular as it is, laser vision correction surgery is not for everyone. If you're sick of wearing those Coke bottle glasses or you're tired of dealing with contact lenses, you may be thinking that LASIK surgery would make your life a whole lot easier.
But do you want it so badly you're willing to believe anyone who tells you what you want to hear, and that is that you're a great candidate? What if you aren't? Regardless of how you feel about your glasses or your contacts, it is your vision at stake here, and serious complications could haunt you for the rest of your life. So tonight, Contact 13 takes our cameras undercover to find out what LASIK-eager patients are being told during those free consultations, and to answer a critical question: are patients who shouldn't have the surgery being approved for it?
All right, don't blink, don't move, don't blink, don't move.
The vast majority of people really are safe candidates.
Perfect.
Unfortunately,
Thank you, Tracy.
Tracy Pilkington is not one of them, according to Dr. Kent Wellish, a local corneal specialist. He says an orb scan, regarded as the most reliable screening tool for LASIK surgery, reveals Tracy has fluctuating corneas that are too thin.
At this point in time, it's not safe to recommend LASIK surgery for her.
Fred, he's a -5.
Dr. Wellish says News 13 managing editor Fred D'Souza is another bad candidate for LASIK. Without first undergoing eye muscle surgery to correct his double vision, he must wear glasses with prisms.
Because someone like him does not have a prayer of being successful with just a laser. Not even a chance, because it doesn't correct the underlying problem, which is a double vision.
Dr. Wellish says he has to turn away about 1 out of every 4 patients eager for LASIK surgery, simply because their risk factors are too high, meaning they have a greater chance of serious complications. And as disappointing as that is for the patients to hear, Dr. Wellish says he's disturbed when they later call him back to inform him they have been approved for the surgery somewhere else.
Treatment complete.
So Contact 13 wanted to see whether Tracy or Fred would be approved for LASIK elsewhere. We sent them to several LASIK centers, including private practices around town.
You would be a great candidate.
You are a terrific candidate. It definitely is a viable option.
Neither bad candidate was rejected for the procedure during any of their consultations. But then again, our patients encountered only sales representatives and technicians during their visits. No doctors and no real testing. Our candidates were given a thorough explanation of the procedure and urged to come back with a $250 refundable deposit to undergo actual testing before their surgery.
And if the place tells them they're a candidate and doesn't do these tests, that tips the patient off right off the bat that this place is either cutting corners or they're segmented into each person doing their own job.
Okay, Heidi.
We also asked Dr. Wellish to screen Contact 13 producer Heidi Carter for LASIK surgery. He said she would be a good candidate until she asked whether her being pregnant would make a difference.
Without a doubt, people who are pregnant should not undergo this procedure.
Dr. Wellish says both the FDA and the laser manufacturers themselves strongly urge against LASIK during pregnancy, given the patient's fluctuating hormone levels and the unknown effects of the antibiotics and steroids on a developing fetus. Heidi has also worn gas-permeable contact lenses for the past 17 years, and Dr. Wellish says she'd have to be out of those for several weeks, maybe months, to allow the shape of her eyes to stabilize before surgery.
It's not unusual to have to be out of them for 1 week for every year.
Yet Heidi was approved for LASIK here at the Bizard Eye Institute and scheduled to have the surgery just 8 days after first walking through the door. That was after she informed the technician that she had worn gas-permeable lenses for 17 years and after she told the doctor himself that she is 8 weeks pregnant.
Dr. Kurt Bizard agreed to an on-camera interview with Contact 13 today, but he got called away on an emergency. Over the phone, he told us he was not aware Heidi was wearing gas-permeable lenses, and after learning that, would have postponed her surgery for at least 3 weeks. As for performing LASIK on pregnant patients, he said, quote, "I don't find an awful big problem with the surgery itself during pregnancy. My pregnant patients do fine as long as we restrict the medication that they take." Dr. Bizard does admit pregnant patients do face a greater chance of needing a second corrective surgery, and of the 5 other LASIK centers we consulted during our investigation, all declined to perform the procedure on a pregnant patient. Coming up on News 13 tonight at 11, what you need to know before you even consider LASIK surgery and how to determine whether you are a good, safe candidate. That is again at 11 o'clock
Points
tonight.
up once again that your health care is just like any other consumer decision. You got to have the facts first, don't you?
And you don't put cash first in a situation like this.
Good advice.
Well, we are
Look at this. We're just about to get started.
Perfect, perfect, perfect. You're looking right at that light.
Corporations and business advisors have come into practices and advise people to retool their system, to look at it more like a business and not like a medical practice.
It's a battle in the highly competitive industry of LASIK surgery. Surgeons in private practice calling the new corporate LASIK centers assembly line clinics that care more about profits than patients. The corporate centers say their competitors just don't like their discounted prices. Well, with LASIK surgery costing as little as $1,000 these days, more patients than ever are going under the laser with a dream of perfect vision.
But that dream can shatter pretty quickly if you choose a clinic that cuts corners or lets some high-risk patients slip through the cracks. And with your eyesight at stake, Contact 13's Allison McCarthy warns price should not be your first priority.
It's an absolute nightmare.
Gary Lapin's LASIK surgery left him virtually blinded in one eye and with double vision in the other. His only cure was a corneal transplant.
I did this to myself. I chose to go in and did this to myself.
Sally Dobler still struggles to see, especially at night, after 3 corrective surgeries and more than 30 visits to the doctor.
You don't want people to have to go through this, and they don't have to go through it.
And according to this local corneal specialist, most serious LASIK complications can be avoided.
Most of them either could have been prevented either before surgery by not operating or afterward if the right therapy had been started soon enough.
Dr. Kent Wellish says most people are safe candidates for LASIK surgery. But if you're the 1 in 4 who may not be, you'll want to find out before you consider going under the laser.
Straight ahead, you're going to see.
And that means undergoing a number of tests performed by either a medical doctor or a trained LASIK technician.
I need you to open real wide. Try not to blink or move.
Most doctors consider the orb scan the most reliable method to determine whether a patient has enough corneal tissue to safely undergo LASIK surgery.
That shows you the thinnest areas of the cornea.
Patients need to have their pupil size measured as well. Larger than average pupils pose a higher risk for sunbursts or halos that can severely impair your night vision.
And after your surgery, Dr. Wellish says it's equally as important that your post-operative care be done by the surgeon himself or at the very least by your family optometrist, a doctor who has known you and your eyes for a number of years and can detect any possible complications as quickly as possible so they can be treated.
In fact, ask your family optometrist which ophthalmologist he'd go to for LASIK surgery, because Dr. Wellish warns any eye doctor can become a LASIK surgeon in just one day.
The most common way that 99% of the surgeons out there have done is taken the one-day laser course.
And I just sat there and cried.
1 year after Martha Harger's LASIK surgery, this professional bartender's night vision was so bad it threatened her job. She suspects now she wasn't taken out of her gas-permeable lenses long enough to let her eyes stabilize before surgery. She'd worn them for 30 years.
And it was only 4 weeks for me, and that was a concern going in, but they kept reassuring me, no, that was no problem. You didn't see the doctor very often. You know, it was just for very few minutes always. That you always saw technicians and the other people in the office.
And that is a red flag right there, according to Dr. Wellish, who says patients need to know where their information is coming from. It may only be a sales rep telling you you're a great candidate.
You would be a great candidate.
You are a terrific candidate. It definitely is a viable option.
Instead of being greeted by someone who truly cares about the patient and really finding out if it's good for them, is motivated by turning that person into a sale, converting them, quote unquote, into a candidate. And then the decision is often made by someone other than the surgeon.
Just be very careful. Just be very, very careful. It's your whole life.
For Contact 13, I'm Allison McCarthy, News 13, inside Las Vegas.
Now, Allison says if you choose to undergo LASIK, go into the procedure with your eyes wide open. Be realistic. Figures reveal only 40% of patients who receive LASIK surgery come out with 20/20 vision. In many cases, patients must still wear their contacts or glasses at least part of the time.